use aripiprazole, also known as abillfy.
Hey guys, it's me. It is HT Sawbar here. Listen to this YouTuber. He's
as well as you, my viewer.
He's my favorite old YouTuber ever seen.
Which is the whole point of this channel.
I guess when I wore my suit for today,
purely informative. This
because
is not medical advice.
St. George is dead from the terrain. Because let's get started. 1, 2, 3.
The generic name of this medication is aripiprazole, but it's sold under several brand names, among which abillfy, and it's available as a tablet or an injection. Which brings us to how to use this drug. First of all, if you want to use it as a tablet, make sure to swallow it whole with half a glass of water. Do not chew on it and do not break it. If you want to use it as an injection, it's always placed by your doctor or your nurse in your buttock muscle. The duration of use usually depends on the actual indication and the severity of your symptoms. When aripiprazole is effective, your doctor will probably prescribe it for 12 to 24 months, and sometimes even longer. Aripiprazole is part of a group of drugs called antipsychotics, which have an effect on several receptors in your brain: your adrenergic receptor, your serotonin and dopamine receptors. And it is often used to treat several severe medical conditions like schizophrenia and moderate to severe manic episodes in bipolar disorder. Normally I would discuss the correct dosages here, but unfortunately I can only provide you with some guidelines, as these differ a lot depending on the specific indication, side effects you experience and severity of your complaints. Usually your doctor will start you off with a low dose and then quickly builds up your maintenance dose. Over time your maintenance dose will be adapted based on the blood levels of aripiprazole you will be having and your symptoms. Therefore always use the prescribed amount and frequency your doctor gave you. Now, aripiprazole is a very effective drug, but unfortunately it has some side effects. I will discuss the most common ones here, but if you're looking for a complete list, then ask your doctor or check your leaflet. Commonly, patients might experience insomnia, restlessness, anxiety, headaches, fatigue, a dry mouth, and erectile dysfunction. And uncommonly, patients experience hypersexuality, depression, a fast heart rate, and a low blood pressure. Which brings us to safety. First of all, be careful when combining aripiprazole and alcohol, as this might increase the dazing effect of this drug. Furthermore, be careful when driving your car, as aripiprazole might cause you to become drowsy, sleepy, and/or dizzy. If you experience any of these side effects, then please do not drive. And lastly, aripiprazole might have interactions with other drugs you're taking, therefore always discuss this with your prescribing doctor. And as always, we end these videos off by taking a look at the safety during pregnancy or when breastfeeding. And unfortunately, aripiprazole can be dangerous in both cases. However, there are some exceptions. Therefore, always discuss this with your prescribing doctor. Now, I hope you know now how to use aripiprazole, but if you have any questions, let me know in the comment section below, and I will do my best to answer all of your questions. And for those of you who want to keep learning, check out the playlist I made in the description or up there. Furthermore, I want to thank my sponsors on Patreon. Thank you, Sebastian, who's an investor tier supporter, and thank all of you for watching this video. If you did learn something, please leave a like. This will help out the video tremendously, and consider subscribing, as I'm making weekly medical videos to educate myself as well as you. Oh, and before you go, I recently made an Instagram account at How to Medicate. I'm posting there pretty much weekly, so follow me there for more content. Thank you all, and as always, I will see you next week with a new video. Bye bye.
Did you hear the man just told you? So, this is following rules from anxiety, and it caused me in trouble. And, that's sudden death. And it's gonna be gonna cause on trouble too. It's gonna be off, on, off, on. I was a little bit of complaints all of a sudden. Yeah, it's gonna let me complaints. And you can check the short video links to subscription down below. Because the hours keep on, off, on, off. That's why it's gonna be complaints. That's all. Just see my scrubs right there? So yeah, do you like it? I've been missing there. So, see my doctor uniform? I got this for my grandfather. I had to take it off later, so yeah. I go to sleep a little bit. Yeah. Yeah, see my, I don't even want to use to show my diploma. It's copyright. Let me, ah. Nah, I can't show it to y'all guys. So, I see this guy on video, links and subscription down below. He talked about some other things, and that's it. And some other abillfy medications. Is my I'm following rules to my doctor. Okay, following rules to my doctor. Now, please, I should never, ever take abillfy. I I do take abillfy, but yeah, shit. I did take a lot of abillfy so much. I keep on, off, on, on. You can check it out. Links in the description down below. And rent, comic, favorite, comic, subscribe down below. I'm Nurse Garrett in the house. Record the message. All right, peace out.